Hey folks, I'm Howard Lux.
Jeff Berg.
We are two boneheads with a lot of experience, and today we're going to talk to you about rotator cuffs, tears, and healing, with a specific interest in stiffness that occurs after surgery. Many of you are going to be stiff. Is that stiffness good for you? Are people who get stiff more likely to heal, and vice versa? Jeff, so lots of people have rotator cuff tears. Let's say that they decide that surgery is necessary. Are all these people going to heal?
No, I wish. Yeah, I mean, a lot of rotator cuff tears, the blood's, I tell my patients it's a tendon that doesn't like to heal. So the blood supply in that tendon is pretty poor. And in fact, most of the time, the reason we tore our rotator cuffs is because it degenerated over time. The blood supply wasn't good enough to heal it, and it slowly accumulated degeneration and tore. And so now we repair that. Doesn't always heal. In fact, a lot of them don't. Fortunately, patients will often feel good even if the tendon hasn't fully healed, which is a little confusing. But nonetheless, patients can do really well without it healing. But back to the point of stiffness, I would say not all tendons heal, but all repairs that I see almost always have a period of significant stiffness, at least my patient.
So I worry more about the patient who comes into the office for their 2-week visit and has no stiffness.
Yeah, if a patient doesn't have stiffness, they almost always failed through their repair. The whole thing is that repair is the weak spot.
Right.
So it's just held together by some stitches, by sutures.
Right.
And, that tissue contracts and thickens. And if you get your motion back too soon, you probably tore through the repair, not. And it's interesting as you say that, because patients will be very proud they have their motion.
Exactly.
They're happy, but I'm really upset. So.
So the paper, we were talking about this paper that appeared in one of our biggest journals, and it showed that in shoulders that were stiff, the rotator cuff tears were more likely to heal. We're talking about run-of-the-mill typical stiffness. We're not talking about those people who come back to the office 2 weeks after surgery and can't move at all. That's a whole different story, right?
Yeah, well, so the way I treat rotator cuff tears is this. For me, the most important thing that I try to tell my patients is getting the tissue to heal. If the patient at the end of the day has full motion, but their rotator cuff is not healed and they're painful, that is an infinitely bigger problem to me than if the rotator cuff heals and they're stiff, right? You would agree that that's really rather simple to take care of, or much more simple. So I'm pretty slow in the beginning and try to give that tendon a chance to heal. So I assume that everybody's going to get stiff. And in fact, I want everybody to get stiff.
Stiffness is our friend.
Once I get comfortable, and that protects the patient from screwing it up too. So once I'm more comfortable that the tendon has healed, then I start aggressively going after stiffness. But in the beginning, I'm have that patient in PT and doing motion just to keep them in the game, just to keep them close by, so that when that tendon heals, we can then, put the pedal to the metal, so to speak.
I agree. I like to distract the patient and let biology heal the problem. I got to tell you, when Joe Ionati published an article about 3 years ago, it showed that rotator cuff tears can occur, or usually are occurring around 6 months, 5 to 6 months after surgery. It was like, oh my God, because I go very slowly, as you do, on recovery. And I paid a price for that, and patients getting very upset. But it turns out, I think, that we were right in the end.
Yeah, I think, well, it's important, so I'll tell the patients right up front, here's what we're going to do. We're trying to thread a needle between not moving you too much so this tendon doesn't heal, not moving you too much and you don't get too stiff, or moving you too much and the tendon doesn't heal. But in the beginning, we're going to move you very little, and we're going to try to get this tendon to heal, and then we'll start working on it. And I find that tends to work pretty good. And if the patients understand it up front, then it works a lot easier. Some patients are surprised about the stiffness And then I think that's a little more difficult for them to accept.
Agreed. I think now we have some more information in our arsenal to share with them, that the stiffness is actually good and could mean that they have a better chance of healing.
Yep.
Always good. So, communication, as always, is key. The more you know about what to expect after surgery, the better you're going to adapt to it, and the more willing you are to go through with it.
Absolutely. Rotator cuff recoveries are difficult, and so it's real important, at least from the surgeon standpoint, to get buy-in from our patients. Absolutely. Because it's a long trip and a long relationship we're going to have together.
Absolutely. Believe it or not, it is hard for us too.
Yeah.
All right, folks, take care.
Yep.